السلام عليكم ورحمة الله وبركاته. نرحب فيكم في فعاليات بريست كانسر اويرنس بترتيب من الاتحاد الحر نقابات عمال البحرين بالتعاون مع النقابة الوطنية لطيران الخليج والنقابة الحرة لشركة مطار البحرين بالتعاون مع المستشفى الشرق الاوسط لهم الشكر. بتبتدي الدكتورة شايستا المحاضرة. حياك.
أنا اسمي عامر الدرازي، رئيس تنفيذي لمستشفى الشرق الأوسط ورئيس جمعية الأطباء، وبالنسبة له طبعا مرض السرطان نائب رئيس جمعية البحرين لمكافحة السرطان. بس حاب أقول لكم بعض الكلمات بما أن احنا في شهر التوعية بمكافحة سرطان الثدي. طبعا الشيء اللي أبي أركز عليه أن احنا واحدة من مهماتنا أن احنا نمحي الجهل بمرض السرطان، لأن مرض السرطان مرض ممكن علاجه، ليس هو حكم بالموت. مرض السرطان إذا تم اكتشافه في المراحل الأولى يمكن علاجه 100% الحمد لله، وهذا يشدد على أهمية الفحص المبكر. بالنسبة طبعا لسرطان الثدي لازم المرأة تفحص نفسها بنفسها على فترات كل 3-4 شهور، وكل مرأة صار عمرها أكبر من 40 أو 45 سنة في عندنا فحص الأشعة بالثدي اللي هو الماموغرام لابد من القيام فيه. موضوع أن المرأة تدخل في اللي هو سامحوني بالإنجليزي دينايل، أن هي تنكر أن هاي الشيء ممكن يصيدها أو هاي ما يخدم، لأن في حال لا سمح الله صار شيء بيتأخر التشخيص وبيتأخر العلاج، وهذا بيأتي بنتائج وخيمة بالنسبة للمرأة. بينما الناس المتفتحة اللي تفحص نفسها حتى لو اكتشفت، نفرض ما تقول ليش صادني، لا بالعكس، أنا الحمد لله اكتشفته من وقت، أروح للدكتور، أروح للأخصائي يعالجني أو الدكتورة يعالجوني وأشفى من المرض. عندنا كمية مرضى كثيرة شفوا الحمد لله متعافيات موجودين في البحرين، وأكيد كل واحدة منكم تعرف واحدة متعافية. فهذا يبين أهمية الفحص المبكر، وهذا الشيء اللي كنت حاب إني أشدد عليه معاكم. طبعا الدكتورة شايستا بتعطيكم شوي نبذة عن هاي الأشياء بتفصيل أكثر، كيفية إجراء الفحص، كيفية إجراء الأشعة، وفيها الخير والبركة إن شاء الله.
Thank you so much for your presence here, and thank you so much, Amel. Thank you so much, Mr. Ghada. So we'll just start. As you know, the breast cancer awareness, it's not like, as I said always, it's not celebration, it's just like awareness. Awareness means we are informing you, we are giving you awareness. You have to go for the checkup, you have to think about yourself, what is the importance of the breast cancer. So in all the health department, many countries, almost all over the world, and especially in the Bahrain also. So we are giving every yearly the breast cancer awareness. So we have to know what is the importance of the breast cancer, why we have to go for the hospital, why we have to go for the screening test. This is very important. Yeah. So as you know, as I said, all the health department, they are giving now these days they're giving the different package and offer for to go for the breast ultrasound and mammogram. So I have just single question from all of you, from the females. Did you have done your ultrasound breast or mammogram? Yes? Very good. No? Okay. Still no? You have to be. So yeah. So as I said, the International Health Organization and all over the countries, like they are giving the awareness about the breast cancer. So we have to think about it, why the breast cancer is important, and the month is, especially in America, when we said USA health organization companies in the early October, they decide to give the awareness all in the October month. The month is aimed to promote the screening and prevention of the disease, especially in the USA, 2.3 million women they are diagnosed with the breast cancer. So this is like not numbers, but it's like the female life. So every year when we say the pink ribbon, the pink ribbon, that means it's reserved for the for the females. So that's why we are just asking, please, not to think, because when I say in the Bahrain STC building, they make it very big ribbon, and this is very good, because when we cross from this area, so the children, they are asking, this is ribbon for what, So at least you have to give them awareness, you have to tell them this is for which reason, okay? So, yeah. So metastatic breast cancer, what is the metastatic breast cancer? The US organization, they decide not only to give the awareness about the breast cancer, but we have to give the awareness about the metastasis. When the women, they diagnose about breast cancer, that means they have a chance for the spreading the other areas. Okay, other areas, there's the underarm, the lungs, the surrounding areas of the tissue of the bodies. So 1,068,000 women, they are diagnosed every yearly. So for example, if they so that's why they said we have to go for the 13th of October to actually give more awareness about the metastasis cancer of the breast. So wait, yes, okay. So the main breast cancer, this is very rare, the main breast cancer, but definitely they decide for the US organization, they said we have to go, not giving only the female breast cancer, but we have to inform the community about the breast cancer as well. They decide to start giving awareness in October 17 to 23rd. So 1 in 1,000 men, they have a chance for the breast cancer. So you will say now the men, they don't have breasts, okay? There is the breast structures are there, but you know, if you see there's a nipple and then behind the areola, the brown color of the male, if someone feel the lump or the swelling, they feel something there or pain, they have to go for the screening, either ultrasound or maybe if they could go for the MRI. I can change it. So why the breast cancer awareness is important? One of the primary reasons when we say the raising the breast cancer awareness is the second leading cause of the death among the women. So this is the main reason we are giving the awareness. So at least because as we said, the early detection means we are saving the lives of the women. Yeah.
What's the first?
Actually, first is most commonly in women. I think it's the skin. It's not in our Gulf countries, but the other countries in the European, they're most common the skin cancers. Yeah. So 1 in 8 women, they can have a chance for the breast cancer. So as we said, they are about almost 12% of the women, they are developing the invasive breast cancer over the course of the lifetime. 1 in every 38 women will have a life disease. So the male breast cancer, as I said, this is only 1 in 1,000 they can develop the breast cancer, but only 1 in 1,000 men will be diagnosed with the breast cancer, the lump, as I said, behind the nipple area. Yeah. So according to the Bahrain statistics, we just found 37.9% of the women, they are diagnosed every yearly in the Bahrain only. So this is very big number actually. Even though, well, the incidence of the mortality rate is of the breast cancer have decreased over the 2 decades, because now we are giving every year the awareness of the breast cancer. So it's going to be decreasing, but definitely still is very high numbers. So this is the other statistics, we take it out from the 2020. This is, if you see the graph, the most common, the breast cancer is showing in the 37.9% in the breast cancer of the women only. But the other cancer, if you compare with the other cancer in the body, maybe 36.4, but only the breast cancer is high number in Bahrain. So what is the breast cancer? So, you know, in our body, we are developing like with the cell growth, function, division, and then function of our body with the depend on the one cell, yeah. But if this cells is functioning not properly, if they have a death of the cells, so they can develop of the cancer. So this is the main reason when we see for example, the normal breasts are cancer due to the damage of the structure of the DNA, and then they have cause for the cellular DNA damage and lead of the control cell death. Yeah. So this is very important. Many of you maybe we don't know about how the breast is look like inside. So for example, this is the left side of the woman breast. For example, this is, if you see, this is the nipple and areola in the brown area above the purple. This is very easy to see during the pictures, but when we see inside, when you see here, this is the nipple, this is the skin, and this is the fatty area. Behind the fatty area, there is purple lines. If you see, especially this is we call the lactiferous ducts, and behind the ducts there is glands. Okay, when this glands, for example, if someone woman you feed your baby's milk, so when the baby is sucking from the nipple here, so first the signal is giving to the brain this ducts, and then behind these ducts the lobules, they start to collecting the milk, and they are taking out. Okay, so these ducts, each of ducts, they have 10 to 15 lobules inside. So this is the most common where the breast cancer is starting, from the ductal area and the lobular area. So this is the more common. Okay. So many times we receive Even the patient, they come to me, they say, doctor, I found a dense breast tissue. I found the dense breast. What is this? So the dense breast tissue, this mostly those women when they are over BMI, they are fatty women, they have more chances for the dense breast tissue, and they have chance to develop in the future over the breast cancer. So if you see the yellowish color, this is like a fatty structures. Normally like category A, then B and C, this is more common. So when they're reaching in the C, so we found they have more chance in the breast cancer. I can change. This is very important slide. Suppose this is on the right side of the breast. So more common area, which area of the breast cancer can be found? 50% in the upper outer area. So if someone complaining about I have pain in the right side, I have pain, for example, this is the breast and they call about this area I have pain and I feel there is a swelling or lump there, yes, you have to go to the doctor, you have to examine yourself. So this is the 50%, 18% is the female is the less area of the breast because this is always a soft and very tiny structure of the breast. So we will, even though when we examine the patients, we feel there is a very delicate tissue inside, but when we feel more on the behind this area. So the 15% on the left side, 6% in the right and left. So any area, I'm not asking only you have to examine yourself on this area, no. You have to be, whenever feeling the pain or any lump or something, you have to examine all the breast, okay. So why early detection is important? Because the chance of the recovery is better if we diagnose early. And then detect the treatment early. So the goal of the early detection is to discover and stop the growth of spreading the tissue in the surrounding area. Survival rate, if we diagnose someone is breast cancer, the survival rate is more than 98%. Yeah. So the risk factor, what is important of the risk factors? We have to we start with the age because 20 years of the age, 50 years of the age, we see the girls, young girls, they come with this different lumps, discharge from the nipple, painful breast, we find, and then they are diagnosed in the early age as well, the breast cancer. So the mostly age is chances more in the 20 to 50 years of the age. The risk increase in the old age, yes, because the women's, they are, for example, one woman, she came to me, she said, I'm 60 years and how come I have breast cancer because I already crossed my age. I said, no, it's not like that because the age is not, the issue. The issue is maybe she has before some symptoms and she ignored herself, especially in our culture, our mothers and aunties, they don't tell anything to their children. Even though they have pain, they have some other issues, they will not tell, they will think 100 times and then they will complain until unless they increase the things, So the family history is very important. If any family history already diagnosed with the breast cancer or another cancer, they have a chance to be developed the breast cancer, and then increase the estrogen exposure. This is those women when they're already reaching in the menopause and they're using the estrogen patch, estrogen cream to developing, controlling her postmenopausal symptoms, they have chance for this more about the breast cancer. Early menarche, late menopause. Early menarche means now these days we are receiving the girls 9 years, 10 years. They're starting the periods actually, so they have more chance in the future. Late menopause, some women they come, they said I'm 60 above, still I have periods. So these women they have to go for the screening as well. The hormone replacement therapy, whoever women they are taking the oral contraceptive to control the pregnancy, not to take the they are taking the medication to control the pregnancy. Yes, they have also the chance if they are taking more than 1 year, they have to go for the breast screening as well. Previous diagnosis of the breast cancer, maybe they have already diagnosed with the previous breast cancer, one side breast cancer, they have a chance to can have other breast side, or maybe they have previous any other cancer, they can have a chance to be developed in the breast cancer as well. Unhealthy fatty food. Most of the working women they are trying to go for the the fast food, frozen food. So you have to please avoid these things. They have more chances because they are mostly, before we said the oil is very good. Now they say the oil is processed oil. So now we are not using. We have to use the ghee. The old time. So this is the things that are going to be reversed now. Previous non-cancerous benign, many young girls, even the women, they come to us and they said, I have a lump last 1 or 2 years before, now I develop again the lump. So when they have a repeated lump, so you see all the lumps is not a cancer actually, there's many benign, okay. So when they have a lump and they go for the repeated breast surgery, should be avoided until this lump is increasing, or maybe you have a pain in this lump, then you have to go for the surgery. Otherwise, if it's there, they will not do anything. So don't worry, but you have to go for the checkup every 6 months to 1 year. Nelly pair, the one women, they are deliver the baby, first baby after 30-35 years of the age, or they are already married but they don't have any children, they have a chance for the breast cancer as well. Obesity, smoking, alcohol is very, very important. Obesity, as I said, the dense tissue, as I showed you the picture, because of the obesity, smoking is not only affecting to the breast cancer, but definitely other cancer like mouth and lung cancer. So this will be related with the females. They have to be chances more for the breast cancer as well. Alcohol definitely is related with the link, same with the smoking. Previous treatment during the radiation therapy, if someone already diagnosed with the breast cancer and then they are going for the radiation therapy, they have a chance more for this surrounding structure like breast, they can have chance for the breast cancer as well. The other one, genetic mutation, the BRCA1 and BRCA2, everybody they have these genes in their body. If someone have a family history, you have to go to check your genes, the BRCA1 and BRCA2, if there is a high numbers are positive or no. This is very important when you can change the other one. This is, I'm just showing you, you have to be, whoever doing the examine their self-examination of the breast. You are doing or not yet? Why?
It's very simple.
It's very important, very important. Taking shower, check yourself. In front of the mirror, you have to check yourself. Especially after the 10th day of the period, you have to check. Before the period, you have pain, don't worry. After the period, 1 or 2 days you have pain, don't worry. This is normal hormonal changes. But after the 10 days you have pain, no, you have to check with your doctor, yeah? So when you see yourself, you have to be see the both breasts should be the same size, not one big and one small. If someone feeling the like pain, you have to palpate yourself where exactly you're feeling the pain. Nipple, you have to check the nipple. Many women they have nipple is inside, we call inverted nipple. You have to check there should be nipple outside, and then you have to press little bit. You will feel any discharges coming or no. So there is different kind of discharge, maybe the watery discharge or bloody discharge. One patient, she told me she has green color discharge. When I took the swab, she has some infection out there. Then I go for the ultrasound of the breast. We found she was the BRCA2. She found it's not cancer, but it's early detection actually for her. As I said, you don't examine yourself only the breast, but you have to do the under the arm as well. You have to palpate inside as well. Yeah. You can change because, yeah, this is the one. So as I said, you have a lump. Anyone have a lump, they have to palpate how much the size of the lump, or you're feeling which area. If there is any red color or color is changing of the skin, yellowish color or pink color, or maybe scaly dry skin is there on this area, this is very important to examine yourself. And as I said, discharge is very important. The size and shape is very important. One have an affected breast cancer, they have a sign like maybe there is a big, one is small, the shape is not good, maybe it's not like oval shape, there is some dimple inside, maybe there is a cracky nipples. There's many symptoms actually. So this is the more important, you have to be know about this. Yeah, change. The risk is high also the people who have any other cancer, as I said, the melanoma of the skin, lung cancer, bowel cancer, or the type of the leukemia, the breast cancer, leukemia cancer and the chronic lymphocytic leukemia. So they have chance can be developed with the breast cancer. And the women, when they have a uterus cancer or cancer in the cervix, they have to go for this breast screening as well. Yes. So the common gene, as I said, the breast cancer, this is coming from the family to each family they have this one, and they're giving to the children as well. So if someone, as I said, someone have already diagnosed in the family, they have to go for this one. I think in Bahrain you have very nice genome center. They are doing free this background. Please, you have to go and do it yourself. Yeah. Okay. BRCA1 and BRCA2 mutation tend to develop more often in the younger women and increase the chance of the ovarian cancer as well. They are associated with this genetic mutation. In the men, the BRCA2 mutation are associated with a lifetime breast cancer, about 6.8%, and BRCA1 mutation are less frequent case of the male. So as I said, the examination is very important. You are sitting at home watching the TV, examine yourself. Going taking shower, examine yourself. At least you know what you do. You have to memorize yourself. You forget, for example. You just make one reminder every year, one date. For example, after 10 days of your period, you know your date is here. After 10 days, you can make a reminder. So when alarm comes, you will remember. So how you examine yourself? This is the breast. Either you have to go like circle all around this area, or you have to go from up to down like a W shape, or you have to go from the right to left like this in horizontal area. Don't forget to examine your nipple, this discharge, or maybe you have to go for the underarm. You have to examine underarm as well. So you have to find if there is any nipple, any small gland, or you feel anything. So as I said, all the breast cancer, they don't have like lump, or maybe sometimes we see the cyst, only cyst. It can go. Many times we see this go by themselves. Okay. Just this is, I said, after the shower you can check yourself as well. This is the way, as I give you the example how you have to examine yourself. This is very important. So the screening guidelines, the early breast cancer does not produce any symptoms, especially those women who are guidelines for the finding the breast cancer early. This can be, as I said, when you have to go for the screening ultrasound, 20 to 30 years of the age, they have to go only the clinical examinations. But in 30 years, if already she is married and she have children, she have to go for the regular every year ultrasound breast. Less than 40 years of the age with the symptoms, they should go for the breast ultrasound. More than 40 years of the age, you have to go for the mammogram directly. Yeah, and then as I said, all women, they have to do the self-examination every month. Yeah. The risk and prevention, should not smoke, alcohol. You have to do every day, you are always working woman, not every day, but at least 3 times in the week. You have to do the exercise, and then you have to go gym, you have to do walking. So you have to concentrate on your weight as well. The most important imaging test, we say the breast ultrasound, diagnostic mammogram, breast MRI, breast biopsy, fine needle aspiration. Fine needle aspiration, when many women, they said, I feel there is a cyst, I feel there is some keys. So they go for the ultrasound guidance, they put the ultrasound probe, and they put the long needle, and they just aspirate the fluid. This is for the send for this culture. If someone is diagnosed with the breast cancer, depend on the stages, the surgical biopsy, just small lump, or maybe if there are already metastasis in the surrounding area, they have to remove, even they are diagnosed only one breast, but they have to go to remove both breasts as well. Yes. So this is very common question, where, what if I found a lump? If you found a lump, so some lumps will go by themselves. It's not like panicky yourself, yeah. So in younger women, the lumps are often related with the normal hormonal related, and then after the menstrual period, it can go. But if you found a lump and it's coming repeated, then you have to check your ultrasound and then examination with your doctor. So the breast tissue naturally has a bumpy structure. If you touch your breast, you will feel there is some small glands. It's not like a lump or something. This is like normal. Someone have a very small breast, they have very tense tissue inside, because the breast is very small organ, you know. So even you touch, you will feel there's a hard and very tiny, tight things you will feel. This is normal. Don't worry about this until unless you have some other symptoms, as I discussed before. So there's many celebrities in the in the world. They had diagnosed and they are survive, and they are very happy with their life. So this is like a moral for those women. Conclusion: breast cancer can be detected early. As I said, more than 98% the survival rate is there. Can be treated very easily. Now these days, the cancer is not like before. They have difficulty to treat. The breast cancer, when it is more treatable, does not produce any symptoms, therefore, if delegate with the breast health. Thank you. So choose the hope, not the fear.